The mission of Harbor-UCLA Medical Center is to provide the best possible medical care to all who walk in the doors. Harbor has served an area of over 2 million people since 1946. In that time, healthcare has undergone enormous changes. Today, Harbor has more than 500 beds for sick patients and more than 120 different clinics. But such numbers fail to tell the story of one of the nation's finest county hospitals. That story is about real people with real problems who are desperately trying to get health care. Many of the patients are working poor and their families who have few other options. Others are middle class, who've lost their health insurance for some reason, or who arrive in ambulances after a heart attack or after a car crash. No matter who they are, they find dedicated professionals to care for them when they arrive. Here are some of their stories.
The paramedics brought in a 2.5-year-old boy who fell out of a hammock, hit his head, and was unconscious for a short time. A CT scan of his head was done to rule out a serious head injury and was normal. The boy went home.
Yeah, this one sounds a little more challenging. Looks like it's a young man that's been shot in his chest. He has diffuse peritonitis. Let's take him up to the operating room right now.
In the operating room, they survey the operative field.
Okay, looks like we've got one hole in the diaphragm here, and the bullet went all the way across the abdomen. There's at least 3 holes in the jejunum, 2 in the duodenum.
In the operating room, Dr. Putnam catalogs the damage. 3.5 hours and 10 units of blood later, the patient is admitted to the intensive care unit. After a 3-month stay, he is discharged recovering. His bill would have been more than $550,000, but the patient has no medical insurance. As the team is finishing in the operating room, a call comes up from the emergency room. They're seeing a 32-year-old nurse with a bad fracture of her pelvis. The next morning, orthopedic surgeons attach an external fixation device to Beth's pelvis to stabilize it. When Beth was in the ICU, we asked her if she was still going to ride motorcycles.
No, never again.
Okay, we got a tier 2 coming in. It's a 15-year-old male with a gunshot wound to the chest. His blood pressure's been falling, but he's responding to IV fluids. His ETA is about 7 minutes.
Okay, he's unresponsive. His pulse is about 140. His blood pressure is in the 70s, but it's up and down quite a bit. Let's run the first 2 liters of fluids in. Ben, why don't you get a line in the right groin? Ahmad, you get the left chest tube in, and Dave, you can get on the right. Looks like his blood pressure is continuing to fall. Okay, looks like his fast exam shows that there's fluid around his heart. We're worried that that's blood. We need to get his heart open pretty quickly here.
When Dr. Putnam said we've got to open the chest, I'm thinking this is a high mortality situation. When I opened the chest and there was a lot of clutter on the heart, we cleaned it up and I saw 2 holes in the heart and put my fingers on them. Dr. Putnam grabbed 2 sutures and gave them to me, and I was able to stitch up the holes. That stabilized him enough to get him up to the operating room. After we were satisfied that the heart had been taken care of, we opened the abdomen and found a big liver laceration. For this, I've never seen anyone survive his chest being opened in the ER. There was blood everywhere. I don't think I've ever seen so much blood.
At the end of the 24-hour period, the chief resident tallies up the numbers. There were 10 trauma runs, 17 in-house consults, 6 patients were admitted to the intensive care unit, and 7 patients were operated on. Quite a 24 hours.